Hello, Tony here from TECARVR. An AI just passed the same medical exam your doctor did. And that's not scary, it's revolutionary. For decades, the United States Medical Licensing Examination, or USMLE, has been the ultimate test of a doctor's knowledge. It's a three-step challenge covering everything from basic science to patient care. You cannot practice medicine in the US without passing it. Recently, a new kind of mind took that test. Not a human, but artificial intelligence. And it passed. Systems like ChatGPT reached or exceeded the 60% passing score on all three parts. Specialized medical AIs like Google's MedPalm 2 have scored in the high 80s and even 90s. That's close to the scores of expert physicians. This is not just a party trick for a computer program. It's a sign that healthcare could get a massive upgrade that affects every one of us. Soon, this tech could work alongside your doctor, speeding up diagnoses and creating personalized treatments that might even save your life. So what does it really mean to have an AI with a doctor's knowledge? And can we, or should we, trust it with our health? Before we talk about the future, let's understand the present. Healthcare systems worldwide are stretched to their limits. Doctors and nurses are burning out at record levels. They are buried under paperwork and overloaded with patients. When they're overworked, mistakes are more likely to happen. Diagnostic errors are a leading cause of patient harm. Many people know the feeling of being just another number in a crowded system. Think about your last doctor's visit. How much time did they spend talking to you compared to typing on a computer? That screen time is a huge source of burnout. It takes clinicians away from what they do best, caring for people. And now there's a looming shortage. The World Health Organization warns we could be short by up to 11 million healthcare workers by 2030. That means longer waits, fewer specialists, and a system under extreme pressure. This is the healthcare environment AI is stepping into. Not to replace doctors, but to give them the tools to work smarter, faster, and with less stress. The AI breakthrough, more than just a good test taker. Passing the USMLE isn't just about memorizing facts. It tests clinical reasoning, the ability to connect symptoms, history, and lab results into a diagnosis and treatment plan. The fact that AI can do this shows it understands and organizes medical knowledge in a meaningful way. Some of the most advanced AIs take this even further. They can break down a medical problem step by step, showing their reasoning along the way. Others use multiple AI agents that debate each other to find the most accurate solution. It's like a panel of expert doctors, but working in seconds. While these systems aren't in your local clinic yet, their accuracy in complex diagnostic challenges is astonishing. They've been trained on millions of medical journals, textbooks, and anonymized patient records. They can spot patterns invisible to the human eye. This isn't just about storing knowledge, it's about fluency in the language of medicine. That fluency could soon shape your next visit to the doctor. What is real-world impact, your future healthcare? AI passing a tough medical exam is more than just a news headline. It is a sign that your future first medical contact might not be a human. In some countries, it is already standard that the first contact with a doctor happens online. This could easily be done with an AI diagnosis system. You log into a secure app and describe your symptoms. The AI reviews your medical history and test results. Within seconds, you get a preliminary assessment and possible diagnoses. This report is sent to a human doctor who checks it and adjusts your care plan. You get faster service. Waiting times are shorter. And the AI has already compared your case to thousands of others for accuracy. So what could this mean for you? First, more accurate diagnoses. AI is becoming a powerful second pair of eyes in radiology, scanning X-rays and MRIs for early signs of cancer or stroke. Some systems have predicted breast cancer risk up to 5 years earlier than traditional methods. This kind of predictive medicine could save lives and catch diseases before they even start. Second, personalized treatment. Medicine has often been one-size-fits-all, but AI can analyze your genetics, lifestyle, and health history to tailor treatments just for you. In cancer care, AI is helping identify unique tumor signatures, leading to custom-designed therapies. This is precision medicine, giving the right treatment at the right time for the right person. Third, the rise of the AI medical assistant. These tools can automate clinical notes, summarize patient histories, and schedule follow-ups. Imagine your doctor looking at you, not a screen, because an AI scribe is recording the details. By cutting admin time, AI gives doctors more time to connect with patients. Let's address the concerns. It's natural to feel cautious about AI in healthcare. The top concern is mistakes. What if the AI gets it wrong? That's why the human-in-the-loop model is key. AI gives recommendations, flags risks, and shows its reasoning. But the final decision stays with a human doctor. Next, data privacy. Medical AIs need a lot of health data to learn. Protecting that data is essential. Regulations like HIPAA already exist, but AI requires even stricter security and anonymization to earn public trust. And then there's the fear of replacing doctors. But AI can't replace empathy, ethical judgment, or the personal connection patients value. It's a tool, not a replacement. Doctors who use AI effectively will be better equipped, but AI will not be the doctor. An AI passing the USMLE is not the end of the story. It's the beginning of a new era in medicine. It signals a future where diagnoses are faster, treatments are more personalized, and healthcare is more human. By handling the heavy data work, AI can help relieve burnout and let doctors focus on patients. The road ahead will need careful oversight, smart regulation, and strong privacy protections. But the potential is huge. This is the partnership of human skill and artificial intelligence, working together to build better healthcare for everyone. If you want to see how AI is transforming our world, subscribe to TECARVR for more future tech updates. And tell me in the comments, would you be comfortable with AI helping your doctor treat you?